Hey guys, my name is Avery. Today is August 12, 2022, and I'm exactly 17 days away from my bottom surgery. In today's video, I wanted to go over bottom surgery and the differences between phalloplasty and metoidioplasty. I did type up a document right here that describes the differences, so I'll go ahead and read that to you guys. Prior to any bottom surgeries, a minimum of 1 year on testosterone is a requirement. So first, we're going to go over metoidioplasty. Metoidioplasty is the creation of a phallus from the hormonally enlarged clitoris. The clitoris naturally enlarges when a person begins to take testosterone. During metoidioplasty, the clitoral ligaments are detached, which allows the clitoris to lengthen and drop into a position similar to that of a natal phallus. On average, the created phallus in a metoidioplasty surgery is between 5 and 7 centimeters long, which may or may not be sufficient to penetrate a partner sexually. A plastic surgeon then sculpts the head of a clitoris to more closely resemble the glands of a penis. Then the labia can be reshaped into a scrotum, which is called scrotoplasty, with or without testicle implants. Metoidioplasty can be done either with or without urethral lengthening procedures. The urethral lengthening extends the urethra along the new phallus, which allows individuals to stand to pee. Phalloplasty is the construction of a neophallus. Different procedures are the radial forearm flap, the thigh flap, and the side flap they use side of your back. In this procedure, the urethral lengthening can be done, as well as several other procedures depending on the individual's needs. A few benefits of metoidioplasty are the erotic sensitivity of the clitoris is still maintained in the new phallus. There are lower complication rates and much fewer procedures in some circumstances. There are less scars. It is also very less amount of healing time than regular phalloplasty. Metoidioplasty is usually more affordable. Some potential benefits of phalloplasty: patients are more likely to be able to sexually penetrate their partners. The phallus is significantly larger than those created through metoidioplasty. And some people feel that the surgery creates more natural looking genitalia. So you guys all know that I'll be having bottom surgery in 17 days. I did decide to have phalloplasty. The procedure that I'm going to have is the radial forearm phalloplasty. So they'll be taking skin from my arm right here and using that to create the phallus. They will be taking a flap of skin from my thigh to cover what has been taken from my arm. That area of skin taken from my thigh is going to be so thin that it will heal on its own. So it will probably just look like a rug burn or a rash. Although the phalloplasty procedure is much more difficult, the healing time is much longer and intensive. I chose phalloplasty because I feel like it fit what I needed. I wanted a larger phallus to match more that of a natural looking penis. I did want to be able to stand to pee, and it was important for me to have penetrative sex. Looking back, it's funny because when I first started taking testosterone, I had never had a surgery before. So I told myself, oh, I'm never gonna have top surgery. I'm never gonna have bottom surgery because I was scared. But after I had my first top surgery, I was like, you know what, this isn't that bad. So I decided, to have the second scar revision for my top surgery. And then, I decided to have the phalloplasty. Without these surgeries, I don't believe I would be able to be myself and be truly happy. So I'm genuinely glad I took that risk in the beginning to have top surgery, because I'm definitely much happier with it. And I can already imagine how much happier I will be after my phalloplasty procedure. Going back to what I said about phalloplasty, they did say that you could have penetrative sex, but the phallus does not get erect by itself. I will have to have another surgery 9 to 12 months after I heal after this one to get an implant. They do have two different implants. They have a semi-rigid rod, and then they have one that's a pump. I will go over that once I get closer to that pre-op appointment, and I can ask the doctor the differences and which one he believes is better. Currently, I do not know which one I want. I'm kind of just weighing out the options. With my bottom surgery being less than 3 weeks away, I did receive my surgical packet from the hospital with a list of all the stuff that I will need for my surgery. So I will go over that in my next video with all the supplies that I bought and what the days leading up to my surgery will be. I did want to thank you guys for watching. If you have any questions, comment below and I will respond or make a video answering your question. Again, thank you guys for watching. Have a great day.